In responding to episodes involving hazardous substances, it may be necessary for response personnel to wear self-contained breathing apparatus, SCBA, and fully encapsulating suits to protect against toxic environments. Donning and doffing of both is a relatively simple task, but a routine must be established and practiced frequently. Not only do correct procedures help instill confidence in the wearer of the suit, they reduce the risk of exposure and the possibility of damage to the suit. It is especially important to remove the equipment systematically so as to prevent or minimize the transfer of contaminants from suit to wearer. The following procedures for donning and doffing apply to certain types of suits. They should be modified if a different suit or extra boots and gloves are worn. These procedures also assume that the wearer has been trained in the SCBA has been inspected and tested, appropriate decontamination steps have been taken prior to removal of the suit or other components, sufficient air is available for routine decontamination and doffing of the suit. Donning and doffing an encapsulating suit is more difficult if the user has to do it alone because of the physical effort required. The possibility of the wearer being exposed to contaminants or damaging the suit is also greatly increased. Therefore, assistance is needed in donning and doffing the equipment. Donning. Preparation. Before donning the suit, thoroughly inspect it for deficiencies that will decrease its effectiveness as the primary barrier for protecting the body. Do not use any suit with holes, rips, malfunctioning closures, or cracked masks. If the suit contains a hood piece or a hard hat is worn, adjust it to fit the user's head. If the suit has a back enclosure for changing air bottles, open it. Use a moderate amount of talcum powder or cornstarch to prevent chafing and increase comfort. Both also reduce rubber binding. Use an anti-fog preparation on the suit and mask face pieces. Donning the suit. While sitting, step into the legs, place your feet properly, and gather the suit around your waist. While sitting, put on the chemical-resistant steel toe and shank boots over the feet of the suit. Properly attach and seal suit leg over the top of the boot. For one-piece suits with heavy soled protective feet, wear leather or short rubber safety boots inside suit. Wear an additional pair of disposable boot protectors if appropriate. Put on the SCB air tank and harness assembly. Don the facepiece and adjust it securely yet comfortably. Do not connect breathing hose. Open the valve to the air tank. The air tank and harness assembly could also be put on before stepping into the legs of the suit. Depending on the type of suit, either put on the inner gloves or for suits with detachable gloves, secure the gloves to the sleeves. In some cases, extra gloves are worn over suit gloves. While standing, put your arms into the sleeves, then your head into the hood of the suit. The helper pulls the suit up over the SCBA, resting the hood on the top of the SCBA, and adjusting suit around SCBA backpack and user's shoulders to assure unrestricted motion. To ease entry into the suit, bend at the knees as the hood is placed over the wearer's head. Avoid bending at the waist as this motion tends to use up room in the suit rather than provide slack. For a tall or stout person, it is easier to put on the hood of the suit before getting into the sleeve. Begin to secure the suit by closing all fasteners until there is only room to connect the breathing hose. Also, secure all belts and/or adjustable leg, head, and waistbands. Connect breathing hose while opening the main valve. When you are breathing properly in the SCBA, finish closing the suit. The helper should observe for a time to assure that the wearer is comfortable and equipment is functioning properly. Doffing. Exact procedures must be established and followed to remove the fully encapsulating suit and SCBA. Adherence to these procedures is necessary to minimize or prevent contamination or possible contamination of the wearer through contacting the outside surface of the suit. The following procedures assume that before the suit is removed, it has been properly decontaminated, considering the type and extent of contamination, and that a suitably attired helper is available. Remove any extraneous or disposable clothing, boot covers, or gloves. If possible, wearer kicks off chemical-resistant boots unassisted. To achieve this, oversized boots are often selected. Otherwise, helper loosens and removes chemical-resistant boots. Helper opens front of suit to allow access to SCBA regulator. As long as there is sufficient air pressure, the hose is not disconnected. Helper lifts hood of the suit over wearer's head, rests hood on top of SCBA air tank. For a tall or stout person, it is easier to remove the arms from the sleeves of the suit prior to removing the hood. Remove external gloves. To minimize contact with contaminated clothing, helper touches only the outside of the suit and the wearer touches only the inside. Remove arms one at a time from suit. Helper lifts suit up and away from SCBA backpack, avoiding any contact between outside surface of the suit and wearer's body. Helper lays suit out flat behind wearer. While sitting, preferably, remove both legs from suit. After the suit is completely removed, roll internal gloves off your hands inside out. Walk to a clean area and follow procedures for doffing SCBA. Remove inner clothing, clean body thoroughly. Additional considerations. If the work site is very dirty or the potential for contamination is extremely high, wear disposable Tyvek or PVC coveralls over a fully encapsulating suit. Make a slit in the back to fit around the bulge of the SCBA backpack. Wear clothing under the suit appropriate to outside temperatures. Even in hot weather, wear long cotton underwear which absorbs perspiration and acts as a wick for evaporation, thus adding body cooling. Long underwear also protects skin from contact with hot surfaces of the suit, reducing the possibility of burns in hot weather. Monitor the wearer for heat stress. If a cooling device is used, modify the donning and doffing procedure. If the low-pressure warning alarm sounds signifying approximately 5 minutes of air remaining, signal your partner and get out of the hazard area. Decontamination. Personnel responding to hazardous substance incidents may become contaminated in a number of ways, including contacting vapors, gases, mists, or particulates in the air, being splashed by materials while sampling or opening containers, walking through puddles of liquids or on contaminated soil, using contaminated instruments or equipment. Protective clothing and respirators help prevent the wearer from becoming contaminated or inhaling contaminants. Good work practices help reduce contamination on protective clothing, instruments, and equipment. Even with these safeguards, contamination may occur. Harmful materials can be transferred into clean areas, exposing unprotected personnel. In removing contaminated clothing, personnel may touch contaminants on the clothing or inhale them. To prevent such occurrences, methods to reduce contamination and decontamination procedures must be developed and implemented before anyone enters a site and must continue, modified when necessary, throughout site operations. Decontamination consists of physically removing contaminants or changing their chemical nature to innocuous substances. Decontamination methods and the extent of decontamination performed depends on a number of factors, the most important being the type of contaminants involved. The more harmful the contaminant, the more extensive and thorough decontamination must be. Less harmful contaminants may require less decontamination. Decontamination, proper doffing of personal protective equipment, and the use of site work zones minimizes cross-contamination from protective clothing to the wearer, equipment to personnel, and one area to another. Only general guidance can be given on methods and techniques for decontamination. The exact procedure must be determined after evaluating a number of factors specific to the incident. Equipment. Decontamination equipment, materials, and supplies are generally selected based on availability. Other considerations are ease of equipment decontamination or disposability. Most equipment and supplies can be easily procured. For example, soft bristle scrub brushes or long handled brushes are used to remove contaminants. Water in buckets or garden sprayers are used for rinsing. Large galvanized wash tubs or stock tanks can hold wash and rinse solutions. Children's wading pools can also be used. Large plastic garbage cans or other similar containers lined with plastic bags store contaminated clothing and equipment. Contaminated liquids can be stored temporarily in metal or plastic cans or drums. Other gear includes paper or cloth towels for drying protective clothing and equipment. Emergency decontamination. In addition to routine decontamination procedures, emergency decontamination procedures must be established. In an emergency, the primary concern is to prevent the loss of life or severe injury to site personnel. If immediate medical treatment is required to save a life, decontamination should be delayed until the victim is stabilized. If decontamination can be performed without interfering with essential life-saving techniques or first aid, or if a worker has been contaminated with an extremely toxic or corrosive material that could cause severe injury or loss of life, decontamination must be performed immediately. If an emergency due to a heat-related illness develops, protective clothing should be removed from the victim as soon as possible to reduce the heat stress. During an emergency, provisions must also be made for protecting medical personnel and disposing of contaminated clothing and equipment. Decontamination of patients. The treatment of critically injured personnel is the first priority. However, the rescuers must take measures to prevent the spread of contamination from the victim to themselves, others, equipment, and medical facilities. Some general rules are as follows. Wear protective clothing appropriate to the type and amount of contamination. This may range from exam gloves and/or masks to complete SCBA. The victim's clothing must be removed as soon as possible, and clothing and personal effects be placed in a plastic bag, double-bagged, and labeled. Unless otherwise indicated, the affected areas must be irrigated and the runoff retained if possible. Communicate with the medical facility early and often. Education and training goes a long way to protect yourself, the environment, and your fellow employees. HAZWOPER training is extremely important, so take it seriously. If you have any questions, please ask your trainer or supervisor, because it's just too important to take chances. Thank you.